Hi, my name is Dr. Eric Pham. I'm one of the surgeons here at St. Joseph Hospital. I'm part of the bariatric surgery program. Today we're going to be talking about bariatric surgery, mainly bariatric surgery revisions. That's when patients have had bariatric surgery and they've, for one reason or another, they've not lost a good amount of excess weight, or they've lost the weight and they've regained back the weight. First and foremost, I like to say that for these patients, there's still hope. We can go ahead and start first with lifestyle changes and behavioral modification. What I like to do is I like to put these patients through nutrition classes, behavioral modification classes, and get them to realize how important it is for lifestyle changes to lose weight. Once they've gone through the preoperative behavioral modification and support group classes, which are all offered here on campus at St. Joseph Hospital, I go ahead and I offer them revisional surgery. There's 3 types of revisional surgeries I will be talking about today. The first type is for patients who've had the band and now have gained back the weight, have not lost the amount of weight they want to lose. Band patients can be converted to either a sleeve gastrectomy or a gastric bypass. Both surgeries are done laparoscopic. Most patients stay in the hospital overnight. They're usually back to work in 2 to 3 weeks, and they usually end up losing 2 to 3 pounds a week. The surgery involves general anesthesia, the band is removed, and either the patient gets a sleeve gastrectomy or a gastric bypass. The second surgery, revisional surgery I want to talk about, are patients who've had the gastric bypass and have regained back their weight. Once again, it's done under general anesthesia. What I end up doing is putting a band on top of the gastric bypass. In essence, the band goes around the pouch from the gastric bypass. The band is adjustable. We can adjust to make the pouch smaller, make patients feel full faster, make them eat less and still feel full. Once again, most patients stay overnight in the hospital and they end up going back to work within 2 to 3 weeks. The last revisional surgery I want to talk about are patients who've had the sleeve gastrectomy and have had problems with the sleeve gastrectomy or have had problems losing weight with the sleeve gastrectomy. For these patients, we can end up doing a conversion from the sleeve gastrectomy to the gastric bypass. Once again, it's done laparoscopic to very small cuts. Most patients spend a night in the hospital and they end up 2 or 3 weeks of recovery at home before they go back to work full time. Whatever pathway is chosen for the revisional surgery, the most important thing is still lifestyle changes. Revisional bariatric surgery is more difficult than doing the surgery originally. However, it is still safe. If you have any questions, please feel free to call us here at the Bariatric Surgery Program.